The Interprofessional Clinic began in August 2011 and is located in the Family Medicine Clinic on the first floor of the medical office building in the University of Kansas Hospital. The Interprofessional Clinic currently consists of third-year medical students, fourth-year nursing students, sixth-year pharmacy students, and a second-year physical therapy student supervised by faculty. The student clinic also provides a medical-legal partnership with law students to improve patient health through legal advocacy. The interprofessional group of students work toward providing patient-centered care while relying on the contributions of each unique discipline to provide patient diagnosis, treatment, and education.
From the nursing perspective, the clinic has been a great experience. I've learned how to speak with my fellow colleagues. I haven't had much experience speaking with pharmacists before and med students, so this has gotten me a lot more comfortable with the teamwork aspect of healthcare. I also feel that being in a team, we give so much better patient care because there are things that I might not think about that the med student will think about, or I'll forget something that pharmacy knows. So by doing this, we definitely give better patient care.
Okay, so when I first came to the interdisciplinary clinic, I didn't know what to expect. Coming into it though, I knew that I wanted to participate. I looked forward to not only working with a pharmacy crew, a nursing crew, but to really just kind of combine our forces. It kind of enables all of us to work at our full potential. Sometimes if I forget something, then without a doubt, whoever I'm in there with will pipe up and say it. It's a rewarding experience. That's one of the things I didn't really anticipate coming into this, was how rewarding it was going to be in interacting with a lot of these patients.
Being a pharmacy student, we're always on the Lawrence campus until our last year where we have rotations. And so we don't really have any experience in a clinical setting or with nursing students and med students. So this clinic is a really great way for us to see them in action, see what they do, see the people behind the medications. You know, we fill them for them at our retail locations, but you know, what happens if it doesn't work or what happens if they don't take them? We really don't see the results of that. So this is a really great setting to work with nursing students, med students, with the doctors, with the patients, and figuring out what's best for them and what they need.
I got to the clinic, it took me a while to figure out exactly what I was going to do because the time constraints were so much different than a typical physical therapy visit would be. But I think once we got into a flow of things, we were able to come together as a team and just kind of, each person brought their own piece of the puzzle, and then once we combined it, we got a better picture of what was going on, and then we were able to translate that directly to the patient rather than unnecessary referrals and collaborations outside of the clinic. We were able to do it as one, and then just learning about what everybody else does really helps solidify what you do and why it's important. So I think that was one of the biggest aspects that I enjoyed at the clinic, just figuring out what everybody else does to help me figure out what I do best.
Really our goals are to get students from different professions together so that they can start to practice how to collaborate and how to work together while they're students before they graduate. Because in the past we've talked about how you need to work in teams, and then you get out, you don't do it in school, you get out into the real world and you have no idea about each other's background, what each other can do, and how to work with one another. So that was our main goal, and then as a piece of that, we want to use that interprofessional team to provide better patient care.
The goal of the Interprofessional Clinic is to bring a core multidisciplinary approach of medicine, nursing, and pharmacy students, who each contribute unique perspectives. This distinctive approach allows for a high quality of patient-centered care while working toward an ever-expanding incorporation of professional healthcare students.